About 4 years ago, we were interested in getting a sense of how the average LGBT person might experience care in a hospital setting.
The Healthcare Equality Index is a project that we've been working on for 4 years now, and each year we survey healthcare facilities on issues of concern to lesbian, gay, bisexual, and transgender patients.
It measures some key criteria that we think are the kind of key measures of LGBT inclusion and cultural competence. This is a relatively new program, and so many hospitals are just learning about it with the release of the 2010 Healthcare Equality Index. And so our level of participation is relatively small.
Policies that we're looking at are specific to patient care as far as medical treatment, but the way you treat someone as a family member. Patient non-discrimination policies, we look for inclusion of sexual orientation and gender identity as protected classes. We look for hospital visitation policies that are framed so that they're inclusive of LGBT families. We also look for cultural competency training because the policies are great, but they don't really have any effect if everyone in the facility is not trained about what they mean and how they apply.
The effort that the institution makes to provide LGBT training to as many staff members as possible makes it accessible, makes it comprehensive, and so that's where we're really looking at what are the ways in which you make the policies really come to life within the hospital.
Also, we look at employment policies. Again, we're looking for sexual orientation and gender identity non-discrimination statements, and that's indicative of how welcoming an environment there is in the hospital.
Rather than depending on voluntary responses, the 2010 Healthcare Equality Index was administered to a representative sample of 200 hospitals.
We found that 93% of all of the hospitals in that 200 representative sample did not have fully inclusive patient non-discrimination policies. That's kind of an eye-opening statistic in itself. But there is some overlap there between those hospitals that have always participated in our survey and that 200 list. So those hospitals that were among the 7% that were inclusive of LGBT rights in their patients' Bill of Rights, the majority of them were HEI participants. So we can take pride in the fact that we've engaged the hospital industry and helped them develop these policies, what we call gold standard policies. But we can see we need to reach a much larger audience because there's that 93% that's not fully inclusive that we hope to see increase in the future.
On April 15th, President Obama issued a memorandum protecting every patient's hospital visitation rights.
President Obama was motivated by a story that he became aware of, this high-profile case of Janice Langbin, whose partner died in a Florida hospital, was brought to the surface. It's a case in which Janice was really kept apart from her partner during a really critical time, and it was really because someone was, at the very least, uninformed about the actual hospital policy, and B, possibly, having some personal bias against same-sex couples. His memorandum focuses on visitation primarily. I think there's some extension to how medical decision-making gets carried out, but it's really about a patient deciding and being able to determine who is with them and how they define family. And that it's not up to a hospital to say, oh, a same-sex couple is not really a couple, or, oh, you're not married, so you can't be here.
And I think by him making a public statement about it, he is already starting to change the hospital industry in a positive way. Now, the rules that will be promulgated by the Secretary of Health and Human Services haven't been published yet. That's a process that will play out over the coming year. But the discussion has already started. I think that people are clear that this needs to be addressed. So he's already addressing it just by giving voice to these concerns, giving voice and a spotlight on some of the discrimination.
The primary goal of the Healthcare Equality Index is to encourage medical institutions lacking in LGBT policies to strive towards what the Human Rights Campaign has termed the gold standard.
You have to realize that LGBT people have very good healthcare experiences in a lot of different healthcare settings. Just the absence of the specific language does not mean they're going to be mistreated. But our standard, the gold standard, is that if you have explicit inclusive language, you reduce the instance of interpretation on the part of individuals in the healthcare setting that can create a discriminatory situation.
If a hospital wants to really have a comprehensive approach to best practices with the LGBT community, if they work with us, if they participate in the Healthcare Equality Index, everything we measure, all the indicators we have really give them a good measure of kind of all the areas in which they need to focus attention on improvement, also tells them where they're doing well, gives them some real concrete guidance for making changes and for really institutionalizing these best practices.
We are hoping that this year, especially with the development of new standards from the accreditation organization, the Joint Commission, and the presidential memorandum on hospital visitation, that the inspiration will be there for hospitals to address their policies. So our desire this year is to get the word out quickly that we've been doing this for quite a few years, and we have some good models in place. So hospitals don't have to reinvent the wheel. We're going to be spreading the word about the top performing hospitals in the HEI this year, sharing the model language. So I hope to see next year that we will report that a much smaller percentage of those hospitals don't have their policies at the gold standard.